IUI is a simple technique which is often used by gynecologists to treat infertile couple before we proceed to IVF or ICSI. It is unfortunate, whereas we pay a lot of attention for the ovulation induction protocol and the drugs used in IUI, we often pay less attention to semen preparation technique, which is equally important for the success of IUI. Now, let's understand why do we have to prepare the semen at all for IUI. What happens in nature? In nature, the semen is deposited in the vagina and only the motile spermatozoa move upwards in the uterine cavity. But in IUI, we have to mimic the nature. That is why we have to, it is the preparation is required. In semen, besides spermatozoa, seminal plasma is also mixed, which has prostaglandins. And in washing, we have to remove seminal plasma so that the capacitation of sperms can occur. And besides that, sometimes the dead sperms and pus cells also present in the semen, which have to be removed, otherwise they produce reactive oxygen species. Besides that, washing selects motile spermatozoa as well, which are required for IUI. Now, WHO has certain recommendation for collection of semen. The semen sample has to be collected after 3 to 5 days of abstinence. It should be collected by masturbation, and the husband should be given a labeled vial. We have to tell the husband that the first portion of ejaculate should not be lost. Those couple who have a difficulty in collection, husband can be given non-spermicidal condom for the collection of sperm after intercourse. Now, once we have collected the semen, we have to decide which technique to be used for the preparation. Here it is important to understand one size does not fit all. Different quality of semen require different kind of preparation for IUI. Now, to understand what is called a good sample and what is called a bad sample, it is important for us to understand what is a normal sample first of all. WHO recommends if a sample contains 15 million per ml spermatozoa and if 28% of them are motile and 59% live, it is a normal sample. Of course, morphology is less important, only 4% normal spermatozoa can be taken as a normal sample. Now, we have to decide which sample is good, which sample is bad. The sample with a good parameter or more than normal parameter is considered a good sample. Sample with a below normal parameter is considered to be a bad sample, and sample which has a lot of debris, pus cells and agglutination and a lot of dead sperms is considered an ugly sample. Sometimes when we collect the semen sample, we find there are no spermatozoa. We have to centrifuge this sample at a very high speed, and if we don't find any spermatozoa even after high speed centrifugation, we call it a azoospermia. Sometimes we find very less count. In those cases, we have to pull the sample. Now, coming to the techniques, we normally use two techniques in IUI. One is swim up and other is density gradient. The basis of swim up is that all the good spermatozoa always move upwards, and when we centrifuge, because of the high density nucleus, they always come down to the bottom of the test tube. This property we utilize in swim up technique. In swim up technique, we wash the spermatozoa twice, once at the high speed and second wash is at the lower speed. And then we leave it to swim up, and only the good spermatozoa who swim up, we take the upper portion of the medium and which contains all the good spermatozoa. Other technique is density gradient. This is basically called filtration technique. This technique we use for an ugly sample where there are a lot of dead sperms or pus cells. In this, first step is filtration and second step is the washing. When we filter, we have to use a high speed so that all the good spermatozoa can be filtered and they come at the bottom of the test tube. And in the second step, we have to wash the colloid particles which are there in the filtering media so that we can get only the good sperms. Of course, there is a lot of damage to sperms in this technique because of the high speed and because of the colloid particles. So this is, although the yield is, although we get good spermatozoa, but this is of course damaging technique. So that is why we don't use this technique in all the samples. Now, there are other two techniques available for a very good sample and for a very low count sample. For a very good sample, we can use migration technique. In this technique, we underlay the semen below the media and then we just leave it in the incubator at 37 degrees centigrade for 45 minutes. And all the good spermatozoa, they move upward, and then we take the upper part of the media which contains all the good sperms, and we use this for IUI. Another very simple technique is simple wash. This we use in the cases where the sperm count is very, very low. In this, we have to utilize whatever we have. We just simply wash the sample twice and use this for IUI. Certain instructions we must follow while we are preparing the semen sample. First of all, the preparation has to be done in a sterile work area, that means under laminar airflow. We should wear sterile, non-powdered gloves. The dilution, temperature change, everything has to be slow. The basic idea is to avoid damage to sperms by temperature change, by centrifugation and by dilution of the media. It is very, very important that before preparation, when we take the patient for IUI, it is very, very important that one semen analysis is done prior to the preparation, so that we can decide which media to be used, and we keep the media in the incubator at the same time when we keep the collected semen sample in the incubator. Now we have to compare all the 4 techniques available for semen analysis. Here we can see the pellet swim-up is for it's a routine for IUI. The only disadvantage is that there is some deleterious effect of reactive oxygen species and the spin, because we don't remove dead sperm, we don't filter the dead sperms here. In density gradient, since we are filtering, it's a very good technique. We get a very clean sample, but there is some damage of the ultrastructural damage to the integrity of sperm membrane. Migration technique is very, very useful. There is no damage of spinning, but it can be used only in the samples which has a very, very highly motile sperms in the are present. Simple wash is best for low volume count. In this technique there is removal of seminal plasma only, and we use all the whatever sperms, the dead or motile, we use for the preparation. Now let us see what the Cochrane review says. In 2009, a meta-analysis was done, including in which 5 randomized controlled trials were included, including 262 patients. It was found that whichever technique we use, whether it is wash-in, centrifugation or density gradient, there is no difference in the pregnancy rate, there is no difference in the miscarriage rate, and there is no difference in the multiple pregnancy rate too. So the author's conclusion was that, irrespective of the method of preparation, the results are same. The bottom line of this talk is that in-house IUI facility is best for the good results, and definitely we have to remember that one size does not fit all. We have to choose a different technique for every specimen available.
Dr. Saxena, what is the lab secret of your successful and a very good results of your lab?
Ma'am, it involves meticulous collection, analysis and choice of technique. When I say collection, the husband has to be explained prior to the collection. These are the small tips. He should use a wide mouth container. It has to be a masturbation, and the sample should reach in the lab within 1 hour of the collection, and it should actually be analyzed within 1 hour.
You are doing in-house collection. You are not taking a sample from outside.
We do take, ma'am, sometimes some people who are not able to collect in the lab, but then we instruct them that after the collection, the sample has to be kept in the upper pocket near to the chest so that it is warm, and it should reach the lab within 1 hour of the collection.
I think you did